Hi everyone, I'm Dr. Timothy Gallagher.
And Dr. Michael Marciello.
And we're from Maragal Medical, Neurogenx and treatment for diabetic peripheral neuropathy. Well, we've educated you on this exciting program that we're now offering here at Maragal Medical. This is a Medicare covered procedure if you have diabetic peripheral neuropathy. But what if you don't have Medicare? What if you don't have diabetes? You just have the neuropathy. Can you still be treated? You sure can. For as little as $5.50 per day, you can have access to this cutting-edge treatment technology that not just helps you with your neuropathy symptoms, but actually increases nerve fiber density and helps repair the damage. This is going to be great information, so you're going to want to stay tuned. Okay, Dr. Mike, we've been talking to our subscribers for quite a while now, since the summer when we decided to invest in this cutting-edge treatment technology for neuropathy. We know that it's covered by Medicare if you have diabetic peripheral neuropathy, but that's not the only cause of neuropathy. So what happens to those patients that don't have Medicare or don't have diabetes? They still have access to this treatment, and the treatment is definitely effective. What are some of the other causes of neuropathy that we've been seeing in the clinic that you can describe?
Yeah, diabetes is probably the most common, and certainly the incidence of diabetes across the country is very high. But other reasons for nerves to be damaged in the aspects of the periphery, down into your feet, your toes, even your fingers or hands, really comes into exposure to other chemicals. Most commonly, high sugars is diabetic, but high alcohol, so alcoholic neuropathy, or even chemical exposure from chemotherapy. So a person who has had cancer and has been treated with their chemotherapy treatments that can really take care of their cancer may unfortunately result in their damage to nerves, and you become chemotherapy-induced neuropathy. Other factors are more and less common, but again, exposure to toxic chemicals in the environment, aspects of other chemicals such as medications that can cause nerve damage as well. So we look at that kind of spectrum, but the process is very similar. Once the nerve is damaged, there's a poor blood supply that doesn't help the recovery of the nerve, and then the actual nerve tends to then regress or get worse unless you take away the offending agent, or you can restore some of those nerve fibers back to normal function.
Right, and we've seen some exciting clinical studies with the response in terms of increased nerve fiber density with the Neurogenx protocol. Again, this is a high-intensity electric stimulation that we use a nerve block with so that you can tolerate it. It's completely a comfortable procedure. Dr. Mike talked about, other causes like chemical-induced neuropathy. Well, my mom was our first patient. She has stage 4 ovarian cancer, and thanks to the good work at Dana-Farber, they've kept her going, but one of the side effects is that she's developed neuropathy as a result of the chemotherapy. And if you click on the link below, you'll get to see that video and her response and what the treatment is all about. It's been fantastic, and it opens the door to allow us to treat this population of patients that, boy, classic traditional medical management just revolves around prescription medication to mask symptoms. When we have access to a protocol now that actually helps repair the damage. It's a 12-week program. Patients are coming into the office twice a week. And again, those that don't have Medicare or diabetes, you can still have access to this exciting treatment option for as little as $5.50 per day. More information can always be found on our website at maragalmedical.com. And please consider subscribing to our YouTube channel. We've got a wealth of information on a variety of topics of all the different services we have here at our physical medicine clinic, where we combine both medical care, physical therapy, chiropractic treatment under one roof. Best yet, we take most insurances. Well, that's it for today. I hope you learned something, and I hope you'll pass the information along if you know someone that is suffering from neuropathy. We can help you.